coming into this week. We had some very productive meetings with our partners at the Fresno County Jail. As many of you are probably aware, there's an outbreak going on there. And the current statistics reflect that there's more than 500 cases out of approximately 1,200 individuals who have been tested. The state's not only looking at the overall case count, they're looking at something called the positivity rate. And our positivity rate is currently hovering between 8 and 10%. They really want to see it less than 8%. And I myself want to see it as low as possible. And so we're trying to set a target of 5% or less. Just to give you a snapshot, we actually looked at the number of ICU beds that are currently occupied in the county, and we're occupying 200 out of 270 beds, roughly. That number changes every day, but that means that we don't have a lot more space to add more cases. And with the case counts going up as precipitously as they are, we're quite worried that we don't have room to expand. That's not 200 COVID patients, that's just 200 overall patients. And out of those, I believe the last number I checked was like in the 40s. So about 40 of those patients are COVID patients that are kind of spread out across all of the ICUs here in the county. But the rest of the ICU beds are being taken up by other very critical illnesses that are really not going to let up just because people are suffering from coronavirus. So that's kind of what concerns me, is that at the same time that our hospitals are trying to deliver standard medical care for everything else, now we're stressing them even more with higher and higher caseloads of coronavirus. And the case counts going up. We know just from the biology of this virus that the actual number of hospitalizations and the number of deaths usually trails by a couple of weeks. And so this last week of having increasing case counts gives me a lot of indigestion going into the rest of the summer. And I think July is going to be very tragic in terms of the number of hospitalizations and the number of fatalities that we see as a result of COVID-19, just given the fact that we've already seen such an uptick in the number of total positive swab results that we've gotten.